phony news from around the world. And Healdsburg presents Healthcare on the March with Dim Blather.
Dim Blather, and today I'll be conducting on-the-street interviews with residents of Sonoma County to get their impressions of how the foundation is doing in raising funds for Healdsburg Hospital and the Alliance Clinic. Whoa! Who are you, and where are you going in such a hurry?
I'm the White Rabbit, and I'm late. I'm late for a very important date. Can stop to say goodbye, hello. I'm late.
No, wait, let me just ask you a few questions, please.
I'm terribly overdue. I'm in a rabbit stew.
What do you think of the efforts of the foundation to raise funds for the hospital and the clinic?
Well, I really haven't had time. I'm just too busy, and I have too many things to do.
But do you think we should have a hospital and clinic here in our community?
Well, I'll think about that when I need medical help. I'm late. That'll be really ticked.
He must be from Wonderland. Excuse me, sir. I'd like to ask you a few questions. First, what's your name?
I'm Simon Legree. Why?
Well, I wanted to know how you feel about financially supporting the Alliance Medical Center in our community.
I've never heard of that place, and I don't give money to anybody.
Sir, Alliance Medical Center provides health care for the underinsured and uninsured in our community, like your own workers, sir.
Hey, stay out of my business. I give them $5 an hour. Let them make it last.
It can't last. They get sick, their children get sick, they need health care, and it ends up costing us all money. And it costs you money, too, because your workers miss work.
No. If they miss work, I fire them. I get new ones. This is not my problem. You're a bleeding heart. I don't need you. People like you, leave me alone. Leave me alone.
Excuse me, sir. Could I ask you a few questions?
You certainly may.
Could I have your name, sir?
My name is Max Dunn.
Max Dunn, aren't you...
I'm the CEO of Alliance Medical Center.
Aha, of course. Tell me what kind of programs you have at Alliance, sir.
Well, we really like to concentrate on preventive care for our patients who are primarily underinsured and underprivileged.
Don't you rely on government funding for your programs?
Somewhat.
Then why is it you would need the foundation to assist Alliance?
Well, because the government funding doesn't nearly take care of the problems that we have in providing the funding necessary for our uncompensated care patients.
I see.
And the foundation helps us in a significant way by providing funding for capital needs.
Well, thank you very much, Mr. Dunn. That's been extremely enlightening.
It's always good to talk about Alliance.
Yoo-hoo! Are you doing interviews? Oh, pick me. I do love being interviewed.
Great. What's your name?
My name is Mrs. Gottrox. What's this all about?
Well, I'm asking people of the community about financial support for the hospital and the clinic.
Oh, that? How boring. I have no interest in that whatsoever. You see, I have connections with the San Francisco Hospital, or at least the Santa Rosa Hospital, so I won't need the Healdsburg Hospital or that what's-his-name little clinic. The hospitals in the big cities give the best care.
But I've heard that you just about have to have a family member stay with you at the big city hospitals because the nurses are so overworked.
Oh, darling. Who needs family? I have staff. Ta-ta. Yoo-hoo!
I wonder if it's true that our hospital can't compete with the big city hospitals in terms of quality of care.
No, it's not true.
Who are you and what do you know about hospital care?
I'm Jack Ayer, and I recently had an appendix operation at the hospital, and I'm on the district board.
No wonder you had a good experience. You got special treatment.
Not at all. I'll admit they had an extra long bed and a block and tackle for the appendix, but everyone gets the same great care.
I'm not sure I can take your word on that.
You don't have to. Just look in the Healdsburg Tribune, where every week or two there's a testimonial about the quality of care in our hospital. And if you don't believe that, I've got a winery to sell you.
The hospital was part of the reason why we felt comfortable moving here with a big family. As we're older now, I sure appreciate the idea of having the hospital there. I don't like driving to Santa Rosa, and I don't know anybody that does. And in an emergency, it would be horrendous. So we need our hospital. It's vital to this community.
I'm interested in your views on health care in Sonoma County and especially here in Healdsburg.
My mother has occasion to use it, and my wife has been there as well. We're very pleased with the overall emergency services.
We went to Alliance Clinic and we got great care. And then we also have used the hospital for emergency care. I've taken my 93-year-old neighbor to the hospital and she got great care. The emergency room's great.
Oh, now here's someone who looks like he could use some time at the hospital himself. Excuse me, sir. Excuse me, sir. I'd like to ask you a few questions. What's your name, please?
Ebenezer Scrooge.
I see. And I wonder if you could tell us if you would be supportive of the foundation to help the hospital and the Alliance.
Why ask me? Why do you always ask me? I don't have any money.
Well, sir, I don't mean to get you all riled up, but if you do have some money and thought that you might just be able to help the foundation, and which helps the hospital and helps the clinic.
But what if I do have a little money? What if I do? Am I my brother's keeper?
Well, not everyone's going to help. And now Charlie Siebert has a story about someone who is happy to help. Charlie?
Thanks, Tim. About a year ago, I was at the foundation office and we were doing a little work. It was a time that the County Board of Supervisors were trying to put together a loan to help out the hospital. And the foundation was working very hard to raise money for an emergency room for the hospital. One day a man came in, a fellow, his name was Juan Garcia. And he said he was there to make his second donation. He pulled a $5 bill out of his pocket, straightened out the wrinkles on a table, and then he patted his chest and he said, I have to. It's good for my heart. I've never forgotten that. It is good for his heart. It's good for my heart, and it's good for your heart, too.
Well, I guess today's interviews show us that the people of our community are split on their support of Healdsburg District Hospital and Alliance Medical Center. Which side are you on? I'm Dim Blather. Now this message.
Hi, I'm Mary Ellen Smith, and I want to tell you why the Healdsburg District Hospital is so important to me. In the fall of 1997, I was admitted to the hospital with acute abdominal pain. I never had a history of intestinal problems, but in 36 hours, they were rolling me into the operating room, and the doctors believed that I had a perforated colon and was suffering from peritonitis. They were right. In another 48 hours, I would have been dead. Not only was the care from my doctors wonderful, but even more importantly to me was the care I received from the nurses. I was emotionally shattered by what had happened, and their sensitivity and their compassion made all the difference in my recovery. Thank you.